Heard at Health is sponsored video content brought to you by MedCity News.
Hi, I'm here with Dickon from Lantern. Thank you so much for being here.
Hey, total pleasure. Thanks for having me.
Yeah, so to start, why are employers talking about specialty care right now, and why is it a priority for benefits leaders?
So there are three things to always think about. One is what's happening to these members at this moment in time. They've just been diagnosed with cancer. They need to have major surgery or have an infusion for a chronic condition. Those are pretty critical moments in their lives. Two, it's 50% of total spend, surgery, cancer, infusions. That is a huge cost driver for employers, and yet it's only a small percentage of the total population. Three, it's actually impactable. So you can really, truly lower the cost of care by focusing on these particular items.
Yeah, really interesting. Very well said. Going off of that, navigation has proven to be a bit of a tough business model. So what has made Lantern the exception?
So first of all, navigation typically is focused on the whole population, engaging everybody, or at least engaging those people with chronic conditions. That might be 50% of the total population. When you think about specialty care, for it to be meaningful, impactful, it's only 3 to 5% of the population. That 50% of spend is driven by a tiny percent of the population. So that is a much easier group to engage than 50% of that population. But most importantly, really, we're not just a navigation business. We're actually driving people to our own proprietary network where we can select the doctors, that improves outcomes. But secondly, we can dramatically lower the cost of care because we've negotiated specific rates with the providers to reduce costs by north of 50%. So that has a really meaningful impact in terms of improving affordability for the member, but also for the plan sponsor, really moving the cost needle.
Yeah, absolutely. So what's the ROI with specialty care strategies?
So three things, really importantly. First and foremost, we help people avoid unnecessary care they don't need. So in the case of surgery, roughly 30% of people have unnecessary spinal joint procedures. We help them avoid that. That reduces the number of people getting care, but also in turn improves their outcomes. Additionally, by getting people to the best surgeons, we can then avoid complications. That significantly lowers costs because you don't have to manage the complication. It's also a much better outcome for the member. And thirdly, we're lowering the actual unit cost by negotiating those proprietary contracts. We contract between 110 to 130% of Medicare versus the broad carrier network, which is 250 to 300% of Medicare. So we'll bring a knee replacement from $40,000 down to roughly $20,000. So it's a huge cost savings. So those three items really drive that return on investment, which we aim at 3 times what the employer is spending with us.